Welcome to This Explainer. Today, we are diving deep into the hidden reality of a very stealthy medical invader. We're decoding hepatitis B. Now, you probably think you know this virus, right? It's that liver bug. But as we're about to explore, hepatitis B operates a whole lot like an iceberg. What we typically associate with it, that surface-level liver damage, is really just a tiny fraction of its true systemic impact. So let's pull back the curtain and find out what's really going on beneath the surface of our cells. To truly grasp the sheer global scale of this issue, I want you to consider this number, 316 million. That is not a typo. As of 2019, an estimated 316 million people worldwide were living with chronic hepatitis B. That represents a massive, massive burden on the global populace, and it makes us a really critical threat to public health. I mean, despite having a highly effective prophylactic vaccine available for years now, this virus continues to persist, basically hiding right in plain sight. All right, Section 1, the global stealth invader. Let's understand the scale. So how does this highly contagious invader actually get around? Well, it primarily spreads through contact with infected blood and bodily fluids. Those are its key pathways to finding new hosts. It can absolutely spread via semen and vaginal fluids during unprotected sex, which, by the way, is a primary mode of transmission in places like Europe and America. It also spreads by sharing infected needles or through contaminated blood transfusions, though routine screening has made that pretty rare today. But one of the absolute most critical pathways is vertical transmission. That's when the virus is passed directly from an infected mother to her newborn baby right during childbirth. Moving on to Section 2, Anatomy of a Hijacker. Let's meet this 42 nanometer squatter. Say hello to the Dane particle. This is the actual infectious viral particle itself. It is incredibly small, literally just 42 nanometers across, but it is heavily, heavily armored. It consists of a partially double-stranded DNA genome and DNA polymerase, all hiding inside an inner nucleocapsid. And then that core is perfectly wrapped up in an outer lipoprotein coat that's covered in the hepatitis B surface antigen. That armored shell is exactly what allows the virus to bind to and be engulfed by our liver cells in a process called endocytosis. Once it gets inside the liver cell, the virus flawlessly executes a 4-step hijacking process. First up is uncoating, where the viral membrane drops its armor and releases the core and the viral DNA straight into the host cell's cytoplasm. Step 2 is where the virus's polymerase synthesizes double-stranded DNA to form something called cccDNA inside the nucleus. Then comes Step 3, transcription. This is where the virus literally forces the host's own cellular machinery to convert that cccDNA into new viral RNA. And finally, Step 4, translation and reverse transcription, where all those pieces are translated to build entirely new viral factories. At this point, the host cell is completely hijacked. Now, if you take away one thing here, make it this concept, cccDNA, covalently closed circular DNA. It's a bit of a mouthful, I know, but during that hijacking process, the formation of this cccDNA is the ultimate game changer. It acts like a permanent squatter deeply hidden inside the host cell's nucleus. Because it embeds itself so securely, it is unbelievably difficult for our immune system and even our current pharmacological therapies to clear the virus out entirely. This tiny ring of DNA is the main reason why hepatitis B can persist as a chronic, lifelong infection. Section 3, the silent symptoms. This is where it becomes an asymptomatic threat. You would think a massive, hostile cellular takeover would set off all sorts of biological alarms, right? Well, actually, the reality is much quieter. Most infants and kids under 5 who get infected show absolutely no symptoms at all. Their bodies just don't raise the alarm. And even in older adults, age 30 and up, only about 30 to 50% will ever feel a single symptom while the virus replicates. If you're newly infected and immunosuppressed, you also generally won't show symptoms. For millions of people, there is zero immediate evidence of the profound liver injury happening right beneath the surface. And get this, when symptoms eventually do show up, things like profound fatigue, jaundice, dark urine, or abdominal pain, it happens on average 90 days after the initial exposure. Think about that timeline for a second. It can range anywhere from 60 to 150 days. By the time a patient actually feels sick, 3 whole months might have passed. That makes tracing the original source of the infection incredibly hard and gives the virus a ton of time to spread completely unnoticed. Let's dive into Section 4, Beyond the Liver, the unseen systemic impact. Because it has hepatitis right in the name, we naturally assume it is strictly a liver disease, causing cirrhosis or liver cancer. But shockingly, this virus's impact goes way, way beyond the liver. A major population-based study out of China found that people with chronic hepatitis B had significantly higher risks for a whole host of dangerous non-liver cancers. We're talking stomach cancer, colorectal cancer, pancreatic cancer, oral cancers, even lymphoma. In fact, the risk of lymphoma, which is a cancer of the immune system, was nearly double for those who were HBV positive. The long-term inflammation and high viral loads just don't stay contained in the liver. They affect nearby cells and tissues, totally setting the stage for cancer development throughout the body. So yeah, actually scratch that whole liver-only idea. The virus actively spreads to and can be found in the pancreas, the kidneys, and our blood cells. That means it can cause severe systemic issues. For instance, in the kidneys, it can trigger glomerulonephritis. That's a dangerous inflammation that can lead to serious kidney damage if it's not treated. It's also linked to certain blood disorders and metabolic issues, which compound severely if a patient also has other health problems like diabetes. It literally knocks the entire body off balance. But, it's not just the physical organs taking a hit. We absolutely have to talk about the profound mental health toll this chronic infection takes. Living with the hepatitis B virus is far from just a physical battle. Patients frequently report dealing with really high levels of anxiety, stress, and depression. The societal stigma, the terror of accidentally passing the virus to someone you love, and that constant looming worry over future health complications, it can be incredibly isolating. And sadly, those emotional burdens can actually make it much harder for patients to stay on top of their care and treatment plans. Okay, Section 5, taking back control. Let's talk about managing this invader. I know the depth of this viral iceberg sounds deeply intimidating, for sure, but modern medicine is definitely not defenseless here. By utilizing antiviral medications, specifically nucleotide analogs, or NUCs, patients can successfully suppress the virus's replication cycle. Now, while these drugs rarely remove that stubborn cccDNA entirely, they are incredibly efficient at suppressing HBDNA levels in the blood. That suppression induces the conversion of the active hepatitis E antigen to antibodies, which drastically reduces widespread inflammation. So regular monitoring and early treatment are absolutely vital. Keeping that viral load suppressed prevents the severe liver damage and greatly reduces the risk of all those systemic complications and non-liver cancers we just talked about. So, what is the single most crucial takeaway from this explainer? It's this. Treating hepatitis B requires a proactive, whole-body approach. We have got to stop viewing it with a narrow focus on just a single organ. Staying connected to care, getting those regular checkups, and strictly following an antiviral treatment plan are the keys to catching systemic problems early. It's about protecting your kidneys, your pancreas, your stomach, your mental health, and your immune system as a whole. Which really leaves us with this final wild thought to consider. As we continue to uncover the mysteries of these stealthy, microscopic invaders, we're realizing that our neat little medical categories don't always apply to biology. Think about it. If a virus strictly categorized as a liver bug can silently dictate the health of our stomach, our kidneys, our immune system, and our mind, we really have to ask ourselves, just how much of our overall health is secretly dictated by what's hiding deep inside our cells? Thank you so much for joining me on this explainer. Keep asking those big questions, and I'll catch you next time.